It's become a welcome Monday morning pandemic tradition, the new round of promising vaccine test results. This time it comes courtesy of Oxford and AstraZeneca, which announced the vaccine they developed was 70% effective in its large-scale trials, with one of its dosing regimens proving to be 90% effective. And better yet, it's both cheaper and easier to store than the other two vaccines, showing success rates around 95%. That's Moderna and Pfizer. As I'm sure you know, Pfizer applied for emergency FDA approval of its product Friday. Moderna said it plans to do the same in the next week. If all goes well, one or both could be ready to start distribution by mid to late December. But again, it will take many months more for everyone to get access, and during that time, the only thing that will keep the coronavirus from spreading will be our own vigilance, which many are flat out failing at. About a quarter of total reported COVID cases in the U.S. have come in the last 3 weeks alone. More than 83,000 people are currently hospitalized. More than 1,500 people a day have been dying. And yet masses of people are packing airports, flying near and far to share unmasked meals with others. The TSA says more than 1 million people passed through airports across the country on both Friday and Sunday, and almost as many went through Saturday. That's despite constant pleas from public health officials and other leaders to celebrate at home this year, including Governor Charlie Baker, who repeated himself yet again today.
Celebrate with members of your household and avoid any group get-togethers that you would normally do in a traditional year. Spending a lot of time indoors with many family and friends is exactly how the virus spreads.
The governor also launched a new awareness campaign called Get Back Mass. It's encouraging people to think about some of the normal things they want to get back to in the long run and use it as motivation in the shorter terms to wear masks, social distance, and get tested. But of course, that's competing with brilliant public health announcements like this War on Thanksgiving meme Texas Senator Ted Cruz tweeted out over the weekend, essentially daring people to stop him and others from celebrating Thanksgiving. And by the way, that's right after the National Guard had just been called in to help overwhelm morgues in El Paso, a city whose residents Cruz purports to represent. Joined by Dr. Vanessa Kerry, she's director of the Global Public Policy and Social Change Program at Harvard Medical School, a physician at Mass General Hospital, and the CEO of the nonprofit Seed Global Health. Dr. Kerry, good to see you as always.
Thank you, and happy early safe Thanksgiving. It's wonderful.
And same to you. Celebrate it with very few people. Speaking of that, we've heard the warnings from the CDC. In the last 24 hours, 100 chief medical and chief nursing officers in the state have issued the same warning, yet more than 50% of the American people say they plan to travel for Thanksgiving. How much does that worry you?
It worries me immensely. And as a physician at Mass General, who is expected to be on call 2 weeks after Thanksgiving, I am ready, and anticipating seeing that spike in COVID cases. I think this is a hard time. It's been a hard year. People are fatigued by COVID. I think that it's very hard, and I think there's probably this imagination that, well, I can just speak by this once and it'll be okay. The reality is the cases are rising at the fastest rate that we have seen since this pandemic started. We go up by about 1 million cases a week now in the country. And that's just an unprecedented level. And here in here in Massachusetts, we still have, as you mentioned, we have 1,500 people dying a day, and we're seeing about anywhere from 2,500 to 3,000 cases a day on average. So it's very worrisome.
Also, people like me, city kids and people who have this northern bias like to think, well, it's South Dakota, it's Texas. Mayor Lou Sutters is the head of Health and Human Services for Governor Baker. She runs the coronavirus effort on the part of the state. And today she's explaining the origin of this Get Back Mass message. And she talks about a survey of 1,000 people that was looking at their attitudes. This is in Massachusetts about the coronavirus. Here's Secretary Sutters.
Just over 1,000 people were surveyed to understand their attitudes around COVID-related behavior. About 52% of the folks who were interviewed were COVID cautious, and 48% were life is normal.
48% life is normal in Massachusetts. Who failed? The media? You? You collectively. Who has failed so miserably that half of the people in this state say life is normal?
I think the reasons why we are in the situation we're in and people are not necessarily understanding the severity of this moment of COVID, it's multifactorial. I don't think you can point it to any single one thing. We have never dealt with something like this in modern history. We are very used to, as an American culture, to our civil liberties and the ability to do the things we want to do when we want to do it. We are not used to having to make big sacrifices. And this is a big sacrifice. We are asking ourselves to be part of a community and to give up the things that we enjoy for the well-being, not just of ourselves, but of others also. And I think it's difficult. I don't think the national leadership in this country has done a thing to make this situation better. We are 4% of the world's population, and we are about 20 to 25% of the world's cases and the world's deaths. And the reality is a failure to put the critical public health measures and to signal those from the highest levels of leadership set us all up for failure. Because at the end of the day, even in Massachusetts, there's a huge number of people who chose to buy into the politics of this current administration. And the reality is science and health became political in 2020. It shouldn't be. Science, health, and well-being, there it is, a fact-based thing, and that has just been lost. It's been completely overridden by politics. At the end of the day, though, our economic recovery, our economic well-being, our economic security is our health security. All of it is linked. And I think that's the hard reality we have to embrace.
Let me ask you one more thing about Massachusetts that I and some of my coworkers have been obsessed with. You probably know that New Hampshire and Maine were just added to the list that they have to quarantine if they want to come here. I think Vermont and Hawaii are the only two states that are quarantine-free. But part of the deal, which I'm sure everybody has pretty much memorized, is you come here from any of those other states, which is almost all of them, you either quarantine for 14 days or you have a negative test within the past 72 hours. And again, this is not just Massachusetts, it's almost there. How is a negative test in the past 72 hours protection against anything unless you locked yourself in your room and then were driven or drove yourself here in those 70? I don't get that at all. Can you explain it to me?
You're right, is the truth. And I think this is a big problem that we're seeing around Thanksgiving. People think they can test on Tuesday or Wednesday and they're safe to go celebrate Thanksgiving with their vulnerable family on Thursday. The reality is a negative test only tells you in that moment in time that you are negative. But as we know, the incubation period of COVID is up to 14 days. So a negative test is only good for that moment. We do encourage people to get tested 5 to 7 days after an exposure because that's the most likely sort of peak or when you would be likely to see a positive test. But the reality is we ask people to quarantine for 14 days because that's what it takes to be safest. And so it is, I think that we do know that when systems and places put tests, repeated tests in place to capture those people who convert positive and be able to sort of augment our ability to case contact trace, you have a better chance of, capturing those cases and sort of mitigating the virus's spread. But a single test negative within 72 hours is, for me, not particularly reassuring.
Can we do a minute on good news? Because I'm depressing myself, if you don't mind here. I mentioned at the top, third vaccine in 3 weeks we've gotten good news on. And amazingly, if they get emergency use authorization granted, I think the meeting is on December 10th, as early as the 11th or 12th, according to Pfizer, people in your profession and other vulnerable people may start getting vaccines. The CDC and some advisory board decides who gets them and in what order. I believe that's true. I saw Bill Gates the other night on CNN. He says in a normal time, there'd be websites that have been up for weeks saying what the priorities are, what the order is. When are the American people going to learn where they are and when they are in line for vaccines as they start building out?
Look, there is good news. There's several levels of good news beyond just the vaccine. The reality is we are going to get to the other side of this. And if people can just hold on to that moment of hope and realize we just need to do this a little bit more, a little bit longer, and we will see the other side, there's reason for hope there. The three vaccines, though, that have been coming out, especially with the news of Moderna and Pfizer recently and how successful that vaccine is, and obviously the AstraZeneca that just came out, is incredibly encouraging because we're going to need multiple vaccines in order to be able to cover 7 billion people globally. And the reality is we are not going to be safe until everybody is safe. And so we are going to have to think about a distribution plan that worries about the most vulnerable and worries about how we get a global roadmap to disrupt the vaccine. Because at the end of the day, your clothes are probably manufactured in Southeast Asia. Your raw materials are coming off the African continent. You're doing business in Europe or in China. And so we are connected globally, and we have to be able to think about what a distribution plan looks like that. Within the United States, it's the same idea. Latinx and Black communities have been disproportionately affected by COVID, and we have to think about what it means to distribute into those communities where there's already a big lack of trust in the health system for a whole variety of historical reasons. We have to think about our healthcare workers. We have to think about those that are most vulnerable because of their pre-existing conditions. We have to think about a whole variety of these priorities. And it's true. In any other administration, there would have been much more clarity, and a distribution plan for a vaccine would have been put in place months ago as we thought about what was going to come online, the number of doses we'd have available at what point. The reality is that's not where we are now. So what we do have, though, is an incoming administration that upholds science and believes in sort of ensuring that we have a distribution plan that is critically important. And they are doing the work that needs to be done now to think about those pieces so that as of at least January 20th, there's going to be a clear, concise, and open plan. I think that for now, knowing that we may have a vaccine that comes online and is going to be available as soon as within 2 weeks from now, I think for the amount of vaccine that is going to be available, it's probably going to be enough to cover the essential healthcare workers that are directly dealing with COVID positive patients first and foremost. Now, I don't think there's much disagreement that those are the people who are going to get the vaccine first because we are already losing people to being quarantined because they've been infected in community or they're getting infected in the line of duty. And so we know those folks have to be protected in order to keep our health systems up and running. I think it gets a little bit more tricky when you look at who's going to get the vaccine next. But I think that the timing of process, the number of vaccines that are coming online and the political processes, you're going to see some of that clarity coming very quickly in the next weeks.
So I only have 30 seconds left. Until we get to that good news point, as you described it a minute ago, do our hospitals have the infrastructure in Massachusetts to take care of the people who are going to come down with the virus in those intervening months? Quickly, if you can.
We are incredibly privileged in Massachusetts to have an outstanding medical system. It's not necessarily evenly distributed around the state, and I will tell you that my colleagues and I are exhausted. This is hard, and we are really doing everything we can to care for those that are coming in, and I am deeply in debt and grateful for working at Mass General, which has done a tremendous job to think about how do we provide the kind of care we need to for all our patients, because it turns out pandemics disrupt essential services if we're not careful too. And that means cancer patients, heart patients, pregnant women. Well, everybody needs access to services, and we should be thoughtful. And I'm lucky the hospital's been very, very thoughtful about that preparedness. It's difficult to have that kind of preparedness across the state. I think the state's done a tremendous job to think about that. But the reality is that if we're not taking our individual responsibilities seriously in this moment, especially in the holiday season, we may, be in a situation where our hospitals are overwhelmed, and certainly in parts of the state that don't have access to, have the same density of hospitals we have in Boston. But we shouldn't even be thinking along those lines. We should be thinking from this moment on, everything we do should be to protect ourselves, protect those we love. As I said to folks who were thinking about doing holiday celebrations, it's worth sacrificing giving up a Thanksgiving in order to make sure that you're not mourning somebody in the beginning of 2021.
On that note, here's to a happy and very small Thanksgiving. Vanessa Kerry, thank you so much. Talk to you soon. Appreciate it.